Incident, Insight, Triage by Marty McCafferty and John Lee, performed by Dr. Frans Cronje. The profound importance of triage decisions made by physicians is applied to multiple patients to determine which patient should receive medical care first. In situations involving multiple patients, medical professionals apply a principle called triage. It's the process in which potential patients are categorized according to the severity of their illness or injury. The intention is to prioritize the most ill or injured and those who would benefit most from prompt treatment. Triage requires skill, experience, and professional objectivity. When making these decisions, the resources also have to be considered. The following case illustrates the principles involved in triage. The incident took place at a marine research facility on a remote, sparsely populated Caribbean island. The facility frequently hosted groups of students as part of their outreach program to assist with underwater studies. Management of the facility contacted the local dive operation with what they thought was at least one diving accident casualty and 3 potential others. The first, a 55-year-old professor, and the others, ages 18 and 20. The dive center was staffed by a physician trained in diving medicine, a certified hyperbaric technologist or CHT, trained by Dan to perform a neurological examination, and a nurse. An operable multiplace hyperbaric chamber capable of handling 2 patients was available, with a tender on site. After confirming details about the patients over the phone with management at the research facility, the CHT urged them to transport all 4 divers to the dive center for evaluation. Each of the 4 divers had performed 2 dives, and they were unremarkable. All the dives were within no decompression limits, and safety stops were performed with no rapid ascents. 6 hours after the dive, while walking through the communal cafeteria, the professor collapsed. Lower extremity motor function was compromised, and he reported an overall ill feeling. Not long afterward, the 3 students complained of similar symptoms. Upon arrival at the dive center, oxygen and oral fluids were administered to all 4 of the patients. They were examined by the physician and the CHT. Upon examination, it was determined that the professor had weakness in both lower extremities. After the diagnosis was confirmed between the on-site dive physician, the CHT and Dan, the hyperbaric chamber was readied. Because of space limitations in the dive center, the students were unable to be evaluated in seclusion from each other. So, all 3 were together in the same small room where the histories were presented and examinations were performed. They could not help overhearing the questions as well as each other's responses. They all reported the exact same symptoms and complaints as their professor. Based on the initial evaluations, there were 4 patients in need of hyperbaric oxygen, but the chamber could only accommodate 2 at a time. The 2 patients who could not receive immediate HPOT could continue oxygen therapy until the chamber was available, but who was going to receive immediate treatment and who was going to wait? The facility contacted Dan, seeking assistance with the logistics of patient care. The Dan medic placed a conference call to Dan's attending physician for consultation. Each patient case was reviewed with attention to physical exams, objective findings, reported symptoms, and dive profiles. All agreed that based on objective examination findings and the seriousness of symptoms, the professor was most in need of treatment, and the possibility of evacuation was even considered. The initial examination results of the 3 students, however, were ambiguous and non-definitive. The decision was made to re-evaluate each student without the others present. Although this meant that the patient being re-evaluated would go without oxygen for a short period, the gain was deemed worthy, so they proceeded accordingly. The on-island team performed individual evaluations and examinations of each student. 2 of them were found to have no objective findings of decompression illness. The 3rd student was more assertive about the complaints. Despite the absence of objective findings, decompression sickness could not be ruled out. The 3rd student was included with the professor for HPOT. The individuals who were not in the chamber continued to breathe oxygen and were monitored continuously. After completing a US Navy treatment table 6, which is a chamber treatment requiring almost 5 hours, the professor was evacuated to a facility in Miami for further treatment and additional therapy. He was diagnosed with type 2 decompression sickness involving the spinal cord. The student who also received HPOT reported the symptoms were better after treatment, but returned the next day for evaluation of new, different, non-specific symptoms. The on-site physician chose not to provide further HBO, but kept monitoring him. The symptoms reported over the next day were inconsistent and resolved completely over 48 hours. The students who continued with oxygen therapy alone refused further treatment. They ultimately reported complete resolution of their complaints within the first hour after presentation, and HBO was no longer indicated. A diagnosis of decompression sickness for these 2 patients could not be confirmed or dismissed. Diving injuries often have nebulous symptoms. They can be difficult to diagnose, so call Dan. This is a vital link in care of divers. In this case, the physical attributes of the medical facility complicated the triage process. The on-island team did a commendable job under very trying circumstances. Contacting Dan was an important aspect of patient care, and it ensured effective treatment and eventual evacuation to an appropriate facility. An extra set of trained eyes and ears is always helpful. In emergency situations, diagnosing a problem and responding properly are important steps towards optimizing the outcome. When observing a friend or dive group member suspected of being injured, it is not unusual to become concerned for one's own welfare. Humans are subject to the powers of suggestion. The situation may be complicated when it involves multiple patients and their emotions and group dynamics. It is important for each individual to try to remain calm and objective regarding their own situation. It's a delicate and precarious balance to try to maintain. When an injury or medical issue develops, denial can delay appropriate evaluation and treatment. So one needs to resist the temptation to jump to conclusions either way, and consider evaluation by a medical professional. The integrity of any evaluation depends on objective findings. Also, when assessing injured divers, perform the evaluations as privately as possible. Examine for confirmation by more than one appropriately trained individual may also be helpful. Provide ongoing examinations to evaluate changes in the condition and document everything. Whether you are new, advanced or professional diver, with concentration and focus, these reminders can promote more efficient triage, more accurate diagnosis, and better resolution.